clinicians just recognize they don't have the capability to deliver the best care in real time all the time because knowledge is accelerating so quickly. So we need something to augment our care, and I think people are willing and want that.
Yeah.
At the same time, there are other opportunities. So, for example, we've partnered with a group called Cuventus at SickKids. We have a go live in November for our emergency department, which is AI that's going to help us operationalize lots of kind of patient flow, but also really focus on utilization management. Because often clinicians don't know what they're doing compared to their peers. And we know that even if we can just let them know, then they're going to change some of their behaviors. And so we're excited about that and about the opportunity to use AI and kind of outside of the mainstream idea, because people are very focused on AI for diagnosis and management. That takes a lot of validation. It's going to take a lot of critiquing, but there's lots of opportunity for operations.
Yeah.
This is a great example. If you now bring this to life and think about, okay, I'm the physician or the nurse involved in this situation. How different is my role now? I mean, I am no longer really the expert. And what's going to make a difference to how successful that patient's treatment is? So much of that now is going to depend on my interaction with that person. I have a lot of hope sitting beside you, Jason, having gotten to know you just in terms of your bedside manner. But essentially, this bedside manner is going to be massive. If you connect it back to Bob's comments about being hopeful, the hopeful optimism and getting your kids to be hopeful and optimistic, and look at how much that connects with care and outcomes, so much of that is going to ride on the interactions that the doctors, the nurses, and the other potentially new members of the care team are going to have.
Right. Yeah. And it's going to be a real shift. I mean, the reality is, as healthcare has matured, we've asked more of our physicians and our other providers. And people have been running and running and running, and we've kind of lost our focus about being at the bedside and the empathy and the emotional intelligence that takes. And so we're going to try to redirect it back. And so a lot of these technologies are going to enable us to do that, to do the job that I think drew most people into medicine in the first place. So again, I'm very optimistic. I think these technologies are going to be great enablers. And I think that for the first time, maybe, we have a digital generation that's growing up and is recognizing potential. And there's not the same fear there that it's going to disrupt or take a job away. I think people understand it's going to augment the job, and so there's more engagement than in the past.
Perhaps, yeah.
Just wanted to add to that you said appropriateness of care. So there are certain rules and there are certain papers that will say under a condition XYZ, you should have ABC procedure. So that's one of the areas that we're working on as well, because you can also audit this, right? So we also have systems that will actually go in, and we have one system that will go in and audit for aortic stenosis and make sure that that was properly documented and the procedure wasn't missed. So the machines are able to do that to help find whether appropriate care was used, because there are actually rules. I mean, there's rules and regulations. And then, warn them if a rule is not being followed. Sometimes, you go in for X-ray, you need a certain condition symptom to get an MRI, right?
Right.
So there's all these rules that can be help not having to think about all this, and maybe it was written down in some medical chart and you forgot about it, but maybe we can find the error. And the other thing you mentioned was the optimization of workflows. I didn't mention it, but yeah, we do that today as well in terms of optimizing through analytics of optimal use of MRIs and optimal use of staff and whatnot. Another technology is for your identity, blockchain in terms of your identity. We're looking at blockchain for your personal identity and then who you would want to share that identity with. So that's not so much in appropriate care, but some of the other speakers had mentioned that. So there are some other technologies that will help you control your identity and your data.